Sure.
Yeah, exactly. We're just keeping it as conversational as possible. So yeah, Anthony, would you be able to kind of just introduce yourself and the role that you do at Croydon Health Services?
Yeah. Hi, my name is Anthony Thompson. I'm the Associate Director of Nursing for Medicine, and that's the Directorate for Integrated Adult Care. And that covers all the inpatient medical beds and specialist medicine.
Okay, nice. How long have you been working at the hospital for?
This is actually 1 year and 1 week since I've started at Croydon University Hospital.
Nice. Did anyone throw a 1 year anniversary for you party?
A small celebration of a hot chocolate.
Nice, hot chocolate is always good actually. That's good. Okay, cool. So if we kind of just go straight into the conversation around the vaccine, what was the reason for yourself getting the vaccine?
I started here in February last year, beginning of February, and it was only a few weeks before the full outbreak started, and then before long we were thrown directly into a pandemic. Yeah. I think during that period, the amount of death that I've seen, I mean, in 1 year I don't think I've seen that many people succumb to an illness in my whole 20 years plus of a nursing career. When the vaccine was first conceptualized and described, I was probably one of the doubters, because historically you listen to vaccines, they're developed, they go over a period of time, there's testing, the clinical trials, and it takes a number of years to come to market. And this one seems to have come to market quite quickly.
Yeah, within 2 seconds almost.
Yeah, but obviously when you looked at the risk versus the benefits, it was sensible to be advocating for a vaccine like this that will, once it could do the things that it set out on the table, which was to reduce the severity of the illness on anyone who got the illness, and actually reduce the number of people who die from this horrible disease. I think it's only fair that us as healthcare providers should be advocating to the public that we should be upfront and taking that vaccine.
Yeah, 100%. You said about how there were worries due to the historical nature of how a vaccine kind of comes about. Obviously, with these types of vaccines, although it was approved very quickly, it went actually through all of the clinical trials and safety checks that it should have in order for it to come out with the MHRA, etc. Would you like to kind of speak a little bit on that?
I think it's been in the public domain quite a lot, and anyone who is listening to the media, you would have seen the real quality evidences out there. Bear in mind, if you switch on your social media, and as most young people would do is grab a lot of the headlines from social media, there was a lot of negativity out there also. But again, like I said, the evidence was there. I mean, you saw clinical trials. I mean, some people say, people had some adverse reactions. Yeah. You can have adverse reactions to anything.
To anything, yeah.
So if you were one who was a conspiracy theorist, then put the packet of a paracetamol in front of someone. Paracetamol has from simple to the most serious of complications.
Exactly.
But we've got a situation here where we can address this pandemic and try to put it into control so we can get back to normalcy. Normalcy. I mean, very few people you will see walking around comfortable in a mask, but this is what our life has come to.
Yeah, 100%. So, from that point of view, I feel like you have already touched on it, but why do you think it is important that, people should get the vaccine, that more people should get the vaccine?
I think for us in the clinical environment, we need to be keeping our patients safe, and we need to be keeping those around us safe also, all of our colleagues, our loved ones, even going out into the community. I've got young children, and I don't want to be having them exposed to potential risks in the community. So schools are a melting pot of infections and diseases and everything else you can think of. But you need the public to understand that the actual issues out there. Yeah. The public needs to understand the high risk that we are putting ourselves through. And if you've got a vaccine there that can help you, why not take it?
Yeah, 100%. I kind of want to speak about the BAME community, but more so our black community. Why do you think that there's kind of hesitation and reservation to actually, take up this vaccine? What do you think it is that us as black people are hesitant to go for? Because in the news, there's a lot about this at the moment. So I really want to kind of speak on that.
I think it is a historical thing, to be honest. When you think about, there's been lots of things that have resurged over the last few months.
Yeah.
You've had the smallpox outbreak in America, the syphilis in America, whereby lots of testing of vaccines and were done on not vaccines, actually giving members of the public and the black community a number of infections and actually then trying to see if you can cure them. So they were used as, in inverted commas, guinea pigs.
Guinea pigs, yeah.
And that has actually come back there and it's come alive and people are not very trusting. Then you had a number of high-profile people who came out and said, "Oh, go to Africa and test the vaccine." And see if all that kind of.
There was some French scientists.
Yeah. So all that kind of rhetoric really put the damper on black people, and and you could see the fear that's there.
Yeah.
The other thing that people feared a lot was that the fact that the hype in the media was that this COVID-19 was actually more detrimental to people of the BAME categories.
Yeah.
And we did see a number of staff from the BAME backgrounds who actually succumbed to this infection.
Yeah.
So the question was, there's now an offer of something which could actually help you.
Yeah.
Why are you scared to take it?
Yeah.
Are you willing to risk yourself with the adverse effects of outcomes of a disease? Or are you looking at the fact that you could actually be saved from a vaccine?
Yeah.
You've got vaccines from years ago, BCG, MMR, all those have been conceptualized, developed, and they've actually helped all races of people. What is so different about this vaccine that we are managing now?
Yeah, I feel like there's a certain level of distrust within our black community towards the government. I feel like that's one of the biggest things. I was watching a couple of videos on ITV and stuff like that, and a lot of it is that people within ethnic minority communities actually feel a sense of distrust towards the government. So they feel as if, due to historical events, if we even take it back just a few years, for instance, something like Grenfell, these types of events make people within our communities feel like they can't trust the government. Therefore, when the government are now saying, take the vaccine, this is going to save you, they feel some type of way. They feel very hesitant about it. And I feel like that's one of the problems that is being faced right now with the uptake of the vaccine. So is there a situation where maybe we need to start putting more authoritative figures within our community at the forefront in order to encourage?
That's what I was just going to come to you about it being. I mean, everything goes back to evidence.
Yeah.
And again, there are certain things that you won't be able to change in people.
Yeah.
There's a group of the public who will actually hear a story, they'll accept it.
Yeah.
There's a group who will be perplexed by it.
Yeah.
And there's a group who will say, well, I can't be in that same category. How do you change them? Yeah. I think the only way you can change them is by actually, they can see the benefits of this vaccine. It is there. We've had very few adverse cases or outcomes with members of the public from all races, especially, and I'll say from the BAME also, who've actually had any adverse effects from the vaccine. So what is the worry? I don't think we will be able to change the historical opinions of others, but it's what you need to look at for the future. You need to think about your family. What do you want for your future? Do you want to be in this state forever? No. So therefore, you need to do something about it.
Yeah, 100%. From a personal point of view, how safe have you found the vaccine. So from point of, going to actually get the vaccine, to receiving it, how was the care that you felt from the actual vaccinator? And now, how have you been feeling in terms of, any side effects or, speak a bit on that.
Like I said before, when the vaccine was first conceptualized, I was a bit hesitant.
Yeah.
But the first thing I had to do was to do a bit of research and get to understand what I'm actually going to put into my body, and then go from there. There's lots of out on social platforms about the context of the vaccine, but when you look at the actual contents and the active ingredients, I mean, scientifically, there's nothing there that was of a worry.
Okay.
For me, when I had the injection, the key thing I had was a sore arm.
Okay.
That was managed well with paracetamol for 1-2 days, and that was it.
Yeah.
But the vaccinator was smooth. I mean, it was quite. I didn't even know she had finished. To be honest with you, and I am as I've got a few muscles, but I hate injections.
I hate them as well.
I can inject 1,000 people, but you can't give me one, and it was quite a smooth and easy process.
Yeah.
And for me, I would advocate it to anyone. Now, since I've had the injection, that's what I've been doing. I've been trying to encourage my colleagues, my friends, my loved ones. I mean, my wife is scheduled to have a vaccine in the next couple of weeks. So I'm encouraging as much people as I can to actually have that vaccine.
Yeah, no, that's great. I think having actually a sore arm after a vaccine is very normal, isn't it? I believe. Yeah.
Same thing happens with the flu vaccine.
Yeah. Exactly. So I think that that is quite an apt point there that you made.
Yeah.
What do you suggest? What do you think should be said to someone who is unsure about getting the vaccine?
For my advice, I will say the amount of, and this is my personal advice, the amount of death, and I have to go back to that I've seen in the last 6 to 8 months, I don't want to see that again. The amount of suffering that I've seen, and this is from all races of people, all ages, both sexes, I do not want to see that again. I want to come to work and work in an environment whereby we are providing the best care we can, and we are just living with our normal conditions, if there's ever such a thing as normalcy. The actual scourge of COVID-19 has affected the entire environment so much that you have patients who've got other conditions that are suffering because we can't provide the care for them.
Exactly.
Yeah? Because we're so fixated on COVID-19. And now we, as all classes of people, especially the BAME group, we have got an opportunity now to say, come out, get yourself vaccinated, at least give yourself that extra protection, and then we can move forward and get our NHS back into what it should be.
Yeah, no, that's great. And I think coming from a senior nurse figure as yourself within the health industry, I think that's a very key message, and I think that is something that is very supported and actually great for others to hear. So yeah, thank you for your time, Anthony.
And thank you for having me.
Yeah, no worries. Great conversation. Thank you.